It's the dawn of a new decade. You can be you again with Shatkin mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Here's how Shatkin mini dental implants will change your life.
I've had problems with teeth.
I couldn't eat almost anything.
I'm gonna go and get this done.
There was no pain. I was very comfortable.
It's just unbelievable what it's done to my life.
And it makes you feel good. It does.
Kind of gave me my life back.
Mini dental implants made me feel like me, made me feel the person I knew I could be and always was inside.
I would recommend it to anyone.
And now I can smile and show the world.
Literally changed my life.
It's incredible. It is. It's absolutely incredible.
This is Innovations in Health. I'm John DeSciullo. Thanks for joining us. We're going to be talking about the mini dental implant procedure that will change your life. And we are welcoming Dr. Rick Redmond.
Thank you, John.
Well, thanks for being here, Dr. Redmond, from RickRedmond Family Dentistry, 101 South Douglas Avenue in Slyacauga. We're going to find out more about our good dentist in just a little bit. But I want to tell you folks, because if you're watching in Slyacauga, anywhere in central Alabama, RickRedmond Family Dentistry is the place you want to go to for the mini dental implant procedure. You can be you again. The mini dental implant is 5 times less. It's less invasive. It's less discomfort. It's less healing time, less visits to the dentist, and less expensive. Imagine folks enjoying the food and all the great friendship with your family without fear that your dentures are going to fall out, without fear of not being able to enjoy life and taste the food. The mini dental implant procedure is something that we are going to talk about. And stay with us for the next half hour because you're going to be amazed at what you see and hear. And I'm coming in from Buffalo, New York to join you, Dr. Redmond, here in Alabama. Show us an example of what we would define as a conventional implant versus a mini.
Yes, this model shows it wonderfully. You can see on here just the small pilot hole that you have to do a mini dental implant, as opposed to the large hole that you have to make to get a traditional implant in. You usually have to make an incision in the gums and do some grafting. It's longer healing time. It's more invasive to do the traditional implants.
Look at the size of the hole on the mini.
Yes.
It's so much smaller. And the titanium post that you use goes into the bone that exists, correct?
Yes.
So that's the mandible that gives us the example of the older conventional versus the mini. And now we're going to show you, if you have a denture, and if you have a lower denture, you're probably used to it swimming around on the bottom of your gums. Yes. Dr. Redmond from RickRedmond Family Dentistry is going to show us why the mini is so great.
Because everybody hates a lower denture. It just moves around, it sits on top of the gums, but with the mini dental implants, you can have that stabilized, and it snaps into place, and it does not move around, and it makes it so much easier.
So imagine, folks, the confidence and the goop that you're used to using to keep those dentures in place. Doc, it's all gone, right?
The goop is gone.
Goop is gone. I like that. I would imagine you swallow a little bit of that goop every once in a while.
Oh gosh, yes, and it gets all over as it's been in the mouth a while, and it's just a mess.
So if you have a lower denture, odds are you probably have an upper.
Yes.
Because with the upper denture, that sense of taste, all the foods that we love here in Alabama, the barbecue, biting into a steak, luscious apple.
Yes.
Look at how the mini dental implant will change you.
It takes more of the mini dental implants. The upper jaw is not as dense, the bone is not, but you can stabilize that. And one of the great things is you can get rid of the center part. It affects your taste, the temperature. Also, it gags a lot of patients. So it is so nice to be able to get rid of that center part.
Yeah, you just showed us with your finger there. All of that plastic is gone.
Yes.
So that crown that is used to kind of use as suction to keep it in a conventional way is not there. And show us how stable that is.
Oh, you can see I have a little trouble snapping that on and off. It holds it very securely, very stable.
And the taste buds that are up in that roof of the mouth are now exposed again.
Yes.
And I would suspect, Doc, that you've talked with a lot of patients who've had the mini dental implant procedure who say, I can enjoy food all over like I used to before.
Yes, it makes a world of difference.
So if you have an upper denture, a lower denture, it doesn't matter what your age, the mini dental implant procedure can help. But it's not just for patients who have dentures. We're going to show you an example now of what we call a fixed on 6.
With this, it takes usually a few more implants up there to hold a porcelain bridge securely into place. And again, you can see how tightly that snaps in, and it looks so natural because it is like having crowns on your teeth.
And these are porcelain because
Yes.
it made to take a licking and keep on ticking, as they used to say.
That is right. Patients cannot take this in and out at home, but at the office, you'd come in at least every 6 months, and we would take this off and clean around the implants, clean the bridge, and then get it back in place.
And these can be used for either upper or lower or both.
Yes, that is right, John.
So, Dr. Redmond, if God gave us our first set of teeth, our baby teeth, and then our adult teeth, you're going to give us our third set of teeth with
Yes.
this mini dental implant example called the roundhouse.
This is a porcelain bridge also that is cemented in place, and it takes yet a few more implants, as you can see, but this is like a third set of teeth. It is in there, it does not come in and out. You do not have to worry about anything other than taking care of it and enjoying your foods.
And that's cemented in, is it
Yes.
not? Yeah. So
Yes.
that's a real permanent
Yes,
situation.
it is.
And look how good that looks. I mean, hold that up. There's no plastic like you see on a denture, and the whole look of your mouth, it really is like a brand new set of
Yes,
teeth.
it is.
You may say, well, I just need 1 or 2 teeth that need to be fixed. So Dr. Redmond, show us what this mini dental implant can do.
Yes, John. We'll have a lot of patients who have partials that come in and out, and they can't stand it. It fits up in the roof of their mouth. And with the mini dental implants, you can do porcelain crowns on smaller areas. You don't have to do the whole jaw. So in this example, there's 3 teeth missing. So you get some mini dental implants in there, and these are cemented in, so it does not come in and out.
And the fact that those teeth in the back of the mouth not only are so important for nutrients, but the shape of your
Yes.
mouth. You want to be able to smile.
That's right.
In the front, you have an example of a single tooth.
Even a single tooth you can have replaced. We recently had a patient who had a front tooth knocked out at work, and you can have a mini dental implant put in there and a custom-made porcelain crown to replace that tooth.
So no matter what your age, it
Yes.
could be anybody that maybe had a hunting or a fishing accident or some sports injury, that mini
Yes.
dental implant will be custom made just for you with a Made in America product.
That is correct.
And I understand, Dr. Redmond, you offer a free consultation for your
Yes,
patients. So
we sure do.
when you meet with them, you'll be able to figure out exactly what they need.
That is right.
And when you meet with the patient to go over what it is that they need, I'm sure that you talk to them about their dental history as well.
Oh yes, we get a good feel for what they've been through in the past.
Right now, I wanted to talk to you a little bit, Dr. Redmond, about the denture itself. If somebody comes in with the denture, you'll work with them. And I
Yes.
understand that there's an individual in your office who is exceptional, who will help make a new denture for you.
Yes, my wife and we have Dr. Casey are both with me at the office. And many times we can use your existing denture and just stabilize it with the mini dental implant.
And it's great that you have all of this team in place. We'll talk a little bit about your background. How long have you been a dentist?
28 years now.
Great. And where did you grow up, Dr. Redmond?
I was born in Tennessee, and all my family is in Alabama and Tennessee, but my father was an engineer, and we moved to Jacksonville, Florida, which is where I grew up. I got my undergraduate degree at University of Florida, and then went up to UAB, to the University of Alabama School of Dentistry for dental school. And then after that, I went out to University of Washington to do a hospital dentistry residency.
So here in Alabama, you've been connecting now with the community for almost 30 years.
Yes.
And there's a family connection.
Yes, when I finished my residency, my great uncle was practicing in Slyacauga, and he was ready to retire, so it was perfect timing for me to come to Slyacauga.
And tell us about your family, Dr. Redmond.
My wife, Joni, and we have a blended family, 3 grown children, and they all live in the area between Harpersville and Auburn.
And your wife is in the practice, and she keeps a lot of the focus on the patients. She's
Yes.
very connected with them.
Yes, very family-oriented
Yeah.
with our patients, for sure.
And you have another
Yes.
great associate, Dr. Casey Price. Tell us about Dr. Casey.
Yes, we were very fortunate. She was born and raised in this area, and after she finished dental school, she wanted to come back to Slyacauga to practice.
So let's meet Dr. Casey.
Hi, I'm Dr. Casey Price. Prior to going to dental school, I had held numerous roles in a dental office, including a chairside assistant, an office manager, and even a dental hygienist. Funny enough, I did dental school in Southern Florida, where one of my preceptors there, once knowing I was from the Slyacauga area, asked me did I know a dentist there by the name of Morris Hollis, whom he had taken an advanced occlusion course from that he learned a lot. I had just been introduced to Dr. Redmond and knew this to be his great uncle, who he bought the practice from. Once being offered a job with Dr. Redmond, I knew I was going into a practice with a legacy full of great dentists. It really was divine intervention how I ended up at Dr. Redmond's office. Dr. Redmond has completed countless hours of training in implantology and taken on the main role of implant guru in the office, which has left a lot of room for me to do more of the bread and butter dentistry, which I love. Being a Slyacauga native, it was really important for me to come home to take care of my friends and family. Dr. Redmond is one of the only dentists in the area that lives, works, plays, and worships in his hometown. This has led me to nickname our dental practice Hometown Dentistry.
Some of your disciplines, Dr. Redmond, come from, I was reading some of the information which is on your website. You're a marathon runner.
Yes, that is one of my passions, and also stress relief is the endurance, doing marathons and also triathlons, Ironmans.
Wow, that's a lot of work.
It is.
And
It's a lot of fun.
Tell us the story about how the Marines were cheering you on in one particular event.
Yes, the Marine Corps Marathon in Washington, D.C. It is very unique, and at the end, there's an uphill section, and they line both sides of that hill with Marines. It's right at the end of the marathon, so you're tired, you're worn out, but they are there cheering you on and inspiring you to finish strong.
And those Marines are a tough bunch because they're
Yes.
doing the marathon with 50 pounds of backpack
Yes.
on them.
Yes.
We're talking to Dr. Rick Redmond from Rick Redmond Family Dentistry at 101 South Douglas Avenue in Slyacauga, Alabama. Here's the phone number. It's up on the screen, but you might want to write it down because you might want to give them a call. 256-724-6670. We talked a little bit about Dr. Redmond's background, and it's all on their website, rickredmondfamilydentistry.com, rickredmondfamilydentistry.com. We talked about me coming into Alabama from Buffalo, New York, and that's where Dr. Todd Shatkin
Yes.
practices. He helped patent this mini dental implant procedure. Talk to us about how you connected with him and bringing that technology back down south.
I have a friend, Dr. Rhett Eklund, and he is the one who suggested I go up to some classes with Dr. Shatkin and see what the mini dental implants were all about. And once I saw the procedure and how much less invasive it was, I was sold.
This is something that's not available in any other dental practice except this one, Rick Redmond Family Dentistry.
Yes.
So if you've been thinking about implants, then Dr. Redmond, not only is he a marathoner, he's going to have that marathon right with you to the finish to make
That's
sure
right.
you look your best. And with that, Doc, you must connect with your patients. We're going to talk about that in just a little bit, but it must really be a gratifying experience when those patients walk
Yes.
away with a new smile.
It is. So many of them come in and they're so discouraged and they don't have any confidence, and to see that change almost instantly is just so fulfilling.
So Dr. Rick Redmond is the go-to dentist in Slyacauga, Alabama, or Central Alabama, anywhere, Talladega on down. If you want to go, you want to see Dr. Rick Redmond. And I know, Doc, we've talked a little bit about your website and what you offer. If somebody has not been to the dentist, as we mentioned, you offer other dental services. What do you offer?
The full range of dental services. We are a family dental office that I've been there almost 30 years, so we do cleanings, crowns, just about anything you need.
And people should not put off going to the dentist because
No.
so much of your health is designed right from the
That
mouth
is
on
right.
down. When you have a mini dental implant or any other procedure, there's a cost involved, but I know you work very closely with the patient to make this an affordable process.
Yes. We have multiple options to make it affordable.
Great, and you can find all of that online, and when you go in for your consultation, and it's free, you'll
Yes.
be able to talk to them about that.
Yes.
And with that, folks, you buy a car and you pay for it on time, you have a mortgage on your house, so there might be some other things in your life that you're paying for. This is really, Dr. Redmond, an investment in you, isn't it?
Yes, it is.
Because you want to make sure that you have the life that you want to live no matter what your age. My mom had dentures and she was a little older, she's passed away, but she sort of resigned herself to the fact that she had to live with whatever that situation was. That's not the case now.
Not anymore.
And the mini dental implants are 5 times less. They're less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. Dr. Redmond, we talked about the mini dental implant being so unique and so technologically advanced. You also have something in your office called the cone beam. It sounds like a science fiction movie. What does
Yes.
that do for the patient?
It is a 3D picture instead of a regular X-ray or radiograph. And that technology has been amazing to have in the office, because to be able to look on the computer and see the upper or lower jaw and the roots of the teeth in 3D and be able to turn it, it makes a tremendous difference in the amount of treatment and the confidence you have in doing that treatment.
So advanced. And I know that even your wife, Joni, you used
Yes.
the CT and you found something that you didn't know even know existed.
She had a tooth that was bothering her, and regular radiographs did not show anything. And we took a CT of that area, and we could see a split in the root that was not showing up on regular x-rays.
So that cone beam technology is available at Rick Redmond Family Dentistry, 101 South Douglas Avenue in Slyacauga, Alabama. The number 256-724-6670, rickredmondfamilydentistry.com. And you remember the American Dental Association, the Alabama Dental Association, the Academy of General Dentistry. You are gaining the knowledge and the experience not only from what you're learning about the mini dental implants, but from all of these organizations as well. And you bring all of that to your patient. Let's talk a little bit about the life that comes back after the mini dental implant. We talked a little bit about food. Is that what you hear from some of your patients?
Yes, I just had a patient in recently that had their lower denture stabilized, and he gave me the reply when I asked him how he was doing, that he'd gained 20 pounds since we'd done that procedure, and that spoke volumes more than anything else you could say.
Well, because you don't have to resign yourself to just eating soft foods anymore,
That's
or
right.
the foods that you're embarrassed to eat for fear of the dentures or your teeth coming out. And these are made in America products. We should really stress
Yes.
that, because that's very important, and it's custom made for the patient.
Yes.
So when you come in for the consultation, how long between the consultation and the actual working of the mini dental implant? What's the time frame?
Just as soon as we can get the patient in, if they're ready to start, if they have a place that is not, does not have a tooth that needs to be taken out, it's just some missing teeth, then that day they can leave with a temporary crown on a tooth if it's a missing tooth or teeth, or with the lower denture or upper denture stabilized that day.
So it's a really fast process.
Yes.
This is not something that's going to take a long time.
Correct.
And we were lucky enough to catch up with some of your patients here in
Yes.
Slyacauga. Let's hear from some of them about what it was like to get the mini dental implant.
My family has been coming to Dr. Redmond's office for well over 15 years.
I always had a good experience.
We've trusted our children here, and of course my husband and I have been here.
I had some broke teeth. They put in my implants, 8 implants, and he got my smile back, my confidence back up.
I can't say enough good things about the office, about the staff.
I've got 2 implants done, and I'm happy and tickled with both of them.
We've never had an unpleasant experience here.
I got now 9 implants, got my smile back, my confidence back, and it's all because of Dr. Redmond and his staff, and I highly recommend it.
The services they offer are top-notch. They have done so much to help me.
I highly recommend having the implants done if that's something that you're interested in.
Obviously, they've given me a fantastic smile.
We family, just a friendly atmosphere, and the great work that y'all do.
They have great teeth whitening services. They have fantastic Botox services. And then that's just in addition to the great tooth care that we get, the great oral care that we get from Dr. Redmond. Now that Dr. Casey is here, she is just as good, and we love coming in to see them both. The staff is great, the office is great. Just come see Dr. Redmond and Dr. Casey.
Dr. Redmond, seeing and meeting those patients, how inspiring to hear from them. And I know that there was a woman that we met. There's a really interesting backstory. In fact, your wife was sharing some of it before we recorded our program.
Yes.
She was sort of dismissed a little bit about some of the work that she needed, but you took that and made her life and brought it back again.
Yes, she had been to multiple dental offices. No one had given her any hope. They had just, like you said, dismissed her, said she did not have enough bone for implants, that there was nothing that could be done other than a lower denture. And she came into our office. We listened to her story. We took a cone beam, and she had enough bone for mini dental implants.
And you've changed her life.
Yes.
As evidenced by that video testimonial.
Yes.
And that's just terrific. And that's just one of the many stories of the mini dental implant procedure that you've been now practicing for a few years doing.
Yes.
And you went to the University of Alabama School of Dentistry.
Yes.
Yeah. And 4th in his class, folks, graduated. So that's pretty impressive. And you had a very special visitor, I'm to understand, that remembered that.
Yes, one of my old instructors from dental school surprised me one day when he came in, and in an interesting twist, after he had been in, coming to the office for a short period of time, he needed implants, and we did the mini dental implant procedure on him to replace some missing posterior teeth.
That's terrific. So he knew of your success,
Yes.
and came to get what he needed. And with that, why do people put off going to the dentist overall?
Most of them are scared. They're afraid of pain, afraid of the cost.
And that doesn't need to be the case anymore.
No.
So you offer some sedation dentistry, because I'm to understand some people don't want to go through a dental procedure unless they're sedated.
That's right. We have the laughing gas, we do oral medications to help you relax, and then we will soon be offering IV sedation also.
So imagine that, folks. You're in the chair and in the office at 101 South Douglas, and then all of a sudden you have a brand new look. It's like
That's
they're
right.
coming out of a perfect dream.
Wake up and it's
Yeah.
and it is done.
If you're just joining us, we're talking to Dr. Rick Redmond from Rick Redmond Family Dentistry, 101 South Douglas Avenue in Slyacauga, Alabama. The phone number, by the way, is 256-724-6670. We've talked about the mini dental implant procedure having really less discomfort. What do you prescribe and give to your patients after the mini dental implant?
Most of the time, you just need over-the-counter medications and ibuprofen, a little bit of Tylenol. It is not a very painful procedure at all.
Yeah, so the fear of that pain shouldn't exist.
That is correct.
Yeah. And how do you take care of the mini dental implant? What would be the recommended procedure?
If you have like the lower denture stabilization, you just brush those implants lightly like you'd brush your teeth. You also, water pick is great to get up underneath that to clean that out.
Yeah, water pick works so well with so
Yes.
much of it, and it's great that you counsel your patients on how to keep them clean, because
Yes.
if we're going to go to all the effort to look this
That
good,
is right.
you want to keep them and looking their best. And
You
feeling
do.
their best. So we're talking to Dr. Rick Redmond. We're here on Innovations in Health. We're talking about the mini dental implant procedure. Now, if you've been with us for the last half hour, you know what a marvel the mini dental implant is. But if you just joined us halfway through and you're thinking, well, what is the mini dental implant? We're going to show you some of these models again and really hammer home the point. So let's look at this mandible again, Doc, and talk
Yes.
about the conventional versus the mini.
Yes, this model shows it perfectly. In the mini dental implant, really all you need is a small pilot hole, and there's no incisions, no major surgery. And you can see on a traditional implant, you have to make an incision in the gums, you've got to expose the bone, drill a much larger hole, so it is not only more invasive, it does tend to be more discomfort afterwards.
And the conventional implants do take more time.
Yes.
Folks, if you've had a lower denture, you have one, and it's swimming around on the bottom of your gums, talk to us, Dr.
Yes.
Redmond, about the stabilization.
Yes, nobody likes a lower denture. It just sits on top of the gums, on the lower jaw. You have to glue it into place, and it still doesn't work very well. That adhesive gets everywhere. But with mini dental implants, you can have usually 4 mini dental implants put in, and it snaps into place and holds that very stable.
And the most important thing we're going to tell you on this show is the goop.
The goop is gone.
Goop is gone, Dr. Redmond says. So that's the lower denture, because
All
if
right.
you have a lower denture, odds are you have an upper. And if you enjoy barbecue, and don't we all in Alabama, and all the great foods, you want to taste them, and you want to
Yes.
have that sensation back again like you did before. Show us how the upper mini dental implant
It
will
takes
help.
a few more implants for the upper jaw. That bone is not as dense, and you can see how securely this holds on. And what is wonderful is you can get rid of that center part there, and it won't gag you. You can taste your foods better. You've got the temperatures. It helps you with your speech, also not having all that bulk up in the center of the denture.
So the denture that as it currently exists before the mini dental implant is there kind of to keep it in place,
Yes,
that
to
suction.
suction.
But it covers your taste buds.
Yes.
So the mini dental implant, now that area is exposed, and look at how stable that is,
Yes.
because
You
it's
can see it.
right there. It's not going to
That's
fall
right.
out. Not going to fall out. Now let's talk about what's called the fixed on 6.
Yes, with a couple more implants in the upper jaw or the lower jaw, you can have a fixed porcelain bridge. And again, you can see how tightly that snaps into place. And that looks so natural. Porcelain, you know, dentists have been doing porcelain crowns forever, and that snaps into place. The patients cannot get that in or out at home, but at the dental office, we'll take that out usually at least every 6 months, so we can keep those implants and the bridge clean to keep it all healthy.
And that's called the fixed on 6. But if
Yes.
you have, as we all know, our baby teeth and then our adult teeth, Dr. Redmond is going to give us our third set of teeth, with what we call the roundhouse.
Yes, with even a few more implants, you can have a porcelain bridge that is cemented in place. And so that is fixed in there just like a third set of teeth.
And this is something that's cemented in, so it's a permanent replacement.
Yes.
Yeah. And
That is it.
this is sort of the premium look.
It is.
And I know that some of your patients have had that premium look and really has brought them a new vitality.
Yes. It really will restore patients' confidence because they don't have to worry about anything.
Yeah. So imagine if you're getting into a new relationship, a new job, or just want to live your life to the best that you can live it, you can do that.
Yes.
Now, I, for one, I have to admit, I don't anymore, used to put off going to the dentist, but if you have done that, you shouldn't do that. Rick Redmond Family Dentistry, 101 South Douglas Avenue is where you want to go. But if you have teeth that are in the back of your mouth,
Yes.
those side teeth, and you're neglecting them because you're thinking they're out of sight, out of mind, those are the teeth, those are very important teeth because they chew the food, they get all the nutrients out. And if you have a partial or something that's happening in the back,
That's right.
show us how the mini dental implant will help.
Yes, John. We have many patients that have partials and they hate those, like on the upper jaw, it'll go up in the roof of the mouth. Even though they come in and out, they're loose a lot of times, or they're just missing teeth in the back. You can have mini dental implants put in and have porcelain crowns.
Look at that, right
put on
there.
top of those.
Snaps right into place.
And those crowns, as you said, are custom made for your mouth and your bite.
I'm sure a lot of our viewers have gone hunting, gone fishing, play sports, and they may have been missing a tooth as a result of an accident. Show us how a single tooth option can work.
Yes, recently we had a patient who had a front tooth knocked out. And so you can have an implant, mini dental implant put there and a custom porcelain crown made for your mouth.
Custom made. No need to be embarrassed by going in.
That is right.
No need to put that off. The mini dental implant will do that. Dr. Rick Redmond, talk to me about what inspires you about being a dentist and why you chose this profession.
It is so fulfilling to see a patient come in that is having trouble. They've been discouraged, they've lost their confidence, and just to see that almost immediate change in them after you are able to restore their smile.
You really do help many, many people,
Yes.
and will continue to do so for many years to come
Yes.
with your wife there, Joni, at the practice, and Dr. Casey, and
yes.
all of the great team that you have. So Dr. Rick Redmond is an innovator in health. We're going to remind you again of the address, 101 South Douglas Avenue, Slyacauga, Alabama. The phone number 256-724-6670, and online, rickredmondfamilydentistry.com. Dr. Redmond, thanks for joining us here
Thank
on
you, John.
Innovations in Health. It's been an honor to meet you.
Same.
Same. All right, and we thank you for watching.